So we started having the town halls, and as a result of them, we developed quite a few different resources. We started a speaker series. We started a tutoring network, which we'll have the pleasure of hearing about today. It's informed some work that we're doing this summer. We've started a child welfare academy for students. So it's really served as a place for us to come together across the university and in support of children and families. However, in light of everything that has transpired over the last week or so with respect to the murder of George Floyd, the uprising that we've seen across the United States and really, frankly, across the world, and all of the various issues that our kids and families are facing at this time, we really feel at the UCLA Pritzker Center that these town halls should be more than a place where we talk simply about COVID-19, but rather about a lot of the issues that our kids and families are facing because they're all interconnected. And so we're going to open the conversation today to more than COVID-19. And we expect that we will continue to do that going forward. And we've talked a lot as a team within the UCLA Pritzker Center about how the town halls can really serve as a democratic forum for us at UCLA to be helpful to kids and families. So you might start to see a little bit of a shift in the coming weeks, and we're really excited to engage with you on that, and most importantly, invite your feedback in that process. So I really want to say thank you for being here, and that's a little bit of background about the town hall. But most importantly, we're really excited and honored, so honored to have Dr. Debra Duardo, the LACO Superintendent, joining us today. And for those of you not familiar, LACO stands for the LA County Office of Education. And I'm going to share a little bit about Dr. Duardo's background, and then I'll turn it over to Dr. Howard to dive in. So Dr. Debra Duardo was appointed the Los Angeles County Superintendent of Schools by the LA County Board of Supervisors in May 2016. She was designated as the top education leader of the nation's most populous and diverse county through that appointment. In this post, Dr. Duardo provides leadership and support to the superintendents and other top administrators of the county's 80 K-12 school districts. Dr. Duardo has more than 30 years of professional experience working with at-promise students and their families. Her unique life experiences as a high school dropout her unique life experience as a high school dropout, able to overcome obstacles and rise to the position of county superintendent, drives her passion to ensure that all students receive an education in a safe, caring environment, and that every student is college prepared and career ready. She holds a master's degree in social work from UCLA, go Bruins, and a doctorate from UCLA's Graduate School of Education. Again, go Bruins. We're so happy to have you, Dr. Duardo. Thank you so much for being here. And with that, I will turn it over to Dr. Howard.
Thank you so much, Taylor. And I want to echo much of what you said. First and foremost, thank everyone for taking time out of your schedules to join us. These town halls are always invigorating, insightful, and I can't say thank you enough. And I want to thank Dr. Duardo. When I initially asked you a couple of weeks ago if you would appear on our town hall, it was to discuss the reopening of schools post COVID-19, and we will definitely get to that during our conversation today. But in the last week to 10 days, we have seen some really, I would say, unprecedented events that have happened with the murder of George Floyd and the global reaction to it. So I'd like to just start off by asking, what are you making of this moment in terms of what you're seeing? Just for you, what has this all been sort of, how have you made sense of it, or how are you making sense of it?
Yeah. Well, thanks, Dr. Howard, and thanks for having me. I mean, it's hard to make sense of it. It's very hard to make sense of watching a man killed on national television, with officers holding him down for almost 9 minutes, ignoring his pleas, ignoring the bystanders' demands to stop. It's very hard to watch. As a mother, it tore me apart when I heard him calling for his mother. And it's hard to understand. There's no understanding it. I think what is clear is and I'm pleased to see the number of people that have come out to protest, that have spoken up, of all races and ages, and different people saying this is just not acceptable. And I'm hopeful that this awareness will create real change. And even as I say that, it hurts me, because this has been something that's been going on forever. And so it's hard for people to say, well, this is going to create change when change hasn't come. So I'm hopeful that this level of awareness and will create some real change.
No, I so appreciate that. And I think the real change, as we all know, can happen in a multitude of ways. One of the things that I've been really intrigued by over the last week is the number of educators who have reached out to me, and administrators who have reached out to me, who have said, hey, I just want to say, how are you? I want to say that I'm enraged. I want to say that now I get it, now I see it. But one of the things that many of them are asking is, what can I do? What should I say? How do I respond? I'm not sure what to say to my students. I'm not sure how to respond to my staff. So I'm curious, Dr. Duardo, what advice would you offer to some of those educators who are trying to process this moment on their own, but they are also in front of students, and they're also in front of teachers, and they're trying to see what are the right words to say? Some have said, I just don't say anything at all, which I don't think is always the best advice. But what would you say to those folks who are looking for some guidance or direction in terms of how to sort of lead these conversations?
Well, I think one, we need to look at all of our systems. I know for me at LACO, we're looking at what we're doing. So it's not only what we're telling others and what we're putting out, but looking at our own house and making sure that we're addressing equity, and that it's at the forefront, and that it's a part of our infrastructure, and not something that we just talk about now in the moment, but that it's something that continues. I tell educators that they need to have these conversations. There's no avoiding these conversations, and they're difficult conversations to have, and for some people more difficult than others. I've been concerned with my staff that are from the African American community, and the weight that they've been feeling, and not wanting to put this burden on them as another thing that they have to solve for the rest of us, and really thinking about how we're making sure that we're taking care of everybody, and that everybody has a voice and responsibility in this. I tell educators they need to learn, they need to listen, they need to act, and these conversations need to happen at every single level with age appropriate communication and teaching, so that children are learning and that adults are learning. And there's no ignoring this. There's no, oh, I'm sorry, it's too hard, I don't feel comfortable, it's gonna create anger or whatever excuses. These are conversations that we have to have, and we need to have the training that we need to be able to facilitate these kinds of conversations, so that they're useful, so that they create progress, so that we don't get stuck. So we're getting a lot of questions too, and really taking the lead in terms of making sure that we're providing the professional development that districts need in order to engage in these conversations and teachings.
No, that's very helpful. And I'm glad you mentioned the professional development, because one of the things that I've always found paradoxical about Los Angeles is that we are one of the most racially and ethnically and linguistically diverse cities, not only in the nation, but really in the world. And I think that's one of the things that sets Los Angeles apart from so many other cities, is our diversity racially and ethnically. Yet, by and large, we still are very uncomfortable talking about race. We're still very uncomfortable really having honest conversations about race. And so I'm curious, how do we begin to sort of push folks to begin to have those hard conversations, knowing that they're going to be awkward, knowing that they're going to be uncomfortable, knowing that we don't always have a playbook or have the right sets of things to say? How do we start to have professional development, trainings, conversations at home? Because what I'm hearing from some of my students is that some of their most difficult conversations around these topics are with their parents and with their family members. So how do we start to develop our courageous muscle to start having these conversations, knowing that it will be difficult?
Well, I've always felt like part of change is starting with policies that require some of these things, because what we're talking about is cultural change getting people to change their minds, their hearts, and that, you know, although it sounds nice and wonderful, doesn't always happen just out of the, you know, good intentions of people. Sometimes you have to ensure that it's part of your structure, part of your policy, and making it a requirement so that these things get done. And then it's like we talked about, it's having the professional development. It's getting people to feel more comfortable with having these conversations. And you've done a lot of that, Dr. Howard. So you know, some of the fears that people have, and, you know, people being afraid of being, you know, called or racist, or, you know, and, you know, getting people to understand that everybody has bias, you know, everybody does. And that, you know, we just have to, you know, we have to have these conversations, and they have to be done in a way that's safe, so that, you know, people will engage, you know, because if it's not done in a way that's safe, by people who know how to facilitate and have been trained to do that, then people are just going to close up, you know, and shut down. So I think that's important as well.
No, I agree. You know, one of the things I frequently say when I have engaged in conversations with folks around this is that I think that the discomfort for folks can be healthy. I think the discomfort sometimes is a way to develop empathy, because as I've talked to some of my white colleagues, I said just the amount of discomfort that you might experience in a 30-minute conversation or an hour-long conversation, just that awkwardness that you feel in having the conversation, magnify that by years when you think about what many Black folks and folks of color experience every single day in other instances when it comes to their discomfort around being in certain spaces. So I think there's a potential value to sitting in the discomfort, to sitting in the awkwardness, to feel what that sort of, you know, does to you physiologically, psychologically, emotionally. So that's good to hear that you're encouraging folks to have those conversations.
You know,
One thing
I just wanted to add, you know, the other concern as a social worker, you know, and me is the is providing some tools for children who are seeing these images, because, you know, children are seeing, you know, it's being played over and over again. They're watching the murder, they are seeing the protests, they're seeing the violence, and I'm concerned with the trauma of that, you know, seeing those images over and over again. And I think we also need to have a process of talking to kids, talking to parents about processing this with their children, and really, frankly, protecting them from seeing some of these images over and over again. So that's just another thing that, you know, I'm concerned about, is what this is doing to children as they've seen these images.
So one of the things I've been intrigued by, and I want to get your reaction to this, is that as I've watched the protests, as I've watched the marches across the country, I have to say I've been encouraged by the numbers of white people I've seen out front and center, who have been out holding up Black Lives Matter signs, calling for the end of anti-Black racism, asking for greater police accountability. I don't know that I've ever seen that optic, and I'm curious if you've seen that, and if you have, does that suggest a tipping point? Are we at a new moment or a new day when we have that kind of a sort of not only multiracial coalition, but when we have the kind of presence of white people who are out fighting for justice as well?
I don't think you could help but notice that. I mean, it's so remarkable, because I've never seen that in my lifetime in any of the, you know, protests or when issues have come up. I've never seen those numbers. And I think it's very powerful, and I think it's absolutely necessary. This has to be an issue that impacts everybody, that everybody is disgusted with, that everybody is willing to stand up and say, this is just not acceptable. And for me to see the number of white people out there is hopeful. That's what I'm talking about, the awareness of people saying, you know, this is it, you know, this, if you don't think this is horrific, and if this doesn't get you to action, you know, I don't know what will. So, you know, and I've heard from some of my colleagues, from some of my friends, someone that I have a lot of respect for, Dr. Judy White, who's a county superintendent in another county, was sharing, you know, that she was actually, as she was talking about it, tears were rolling down her face. And she's an African-American woman who's been in this business a long time, saying, for her to see the number of white people out there holding signs that said Black Lives Matter was really so, you know, moving to her. And so I think that everybody is feeling like, and I hope that this in some way brings some unity, you know, that people see that you know, that the African American community sees that, you know, more and more people realize how horrific this is and stand with them.
Mm-hmm. So I've been encouraged. I'm cautiously hopeful and optimistic. But I have to say, Dr. Duardo, one of the things that has been a bit disturbing for me is to see these massive crowds of people in the midst of a pandemic. And I think there's a number of ways you can look at that. One of the ways you can look at that is that people are willing to put their own health and safety on the line in the quest for racial justice. But I'm also worried about what that's going to mean in terms of potential spikes in the number of COVID cases that we are going to see nationwide. I know prior to the George Floyd situation, you were tirelessly on reopening Los Angeles County schools. Can you share with the group kind of where your thinking is and where we should be sort of aware of what's happening, what's not happening, what are the challenges, what are the opportunities? Where are we at as it pertains to reopening Los Angeles County schools?
Well, it's complicated and it's difficult. What we did at LACO is we brought together 25 superintendents from across the county to build a framework, some guidance to assist districts in reopening. And the decision of when to reopen and the model of instruction that they're going to apply is a local decision. LACO doesn't make those decisions. Each local district has their own board of education that makes those decisions. And for us, what we're putting in our guidelines and in our framework is that we want to make sure that health and safety is at the very top in terms of what we're thinking about as we reopen schools, that we want to keep our children and we want to keep our employees and everybody safe, because there is no cure for this pandemic. You know, nothing really has changed from when we decided to close schools to where we're at now. If anything, now we know that there are a whole lot of people that are asymptomatic that are spreading. So we want to be cautious. But with that being said, I also want to be really clear, because I'm getting so much hate mail, you wouldn't believe it, is that these are not my decisions, that I am not a public health expert, and that we are looking to the Department of Public Health and you know the health experts to tell us what is it that we need to do. You know, there's a lot of controversy over whether young children should wear masks, whether it's practical to physically distance children. We realize that this pandemic hasn't impacted everybody in the same way. And our poor children, which are, you know, disproportionately children of color, have not had the same access to instruction. They have not had the access to Wi-Fi and to the devices that they need in order to learn. Their parents are more likely to be essential employees. They are more likely to have lost their jobs. It's easier for all of us to work from home than people who are working in supermarkets and nursing care facilities. So, I mean, we realize all of that. And, you know, our framework is about how can we reopen schools, or how can we give districts a tool that they can use to make these decisions locally, always following the advice and the orders of the Department of Public Health.
So you and I had a conversation a couple of weeks ago, and you said something during that conversation that is still with me. And you said that we cannot guarantee the safety of all children as it pertains to the virus. And when I sort of let that sort of ruminate in my head for a while, I'm thinking, if I'm a parent and I hear that has to give me some serious pause. And there are probably lots of parents and caregivers out there who don't feel comfortable sending their children back to schools, and no matter what format we ultimately come up with. What would you say to those parents and caregivers who have some serious concerns about the safety of schools, even as you think about all the considerations that you've just mentioned?
Yeah. Well, one, I'd say I'd understand their fears and concerns, and as a parent, I share those concerns. When I say we can't guarantee the safety, we can't guarantee that a child is not going to contract this virus at school. It's the same it's anywhere else a child goes out in public. When you take your child to the supermarket, when you take them to pick up food at McDonald's, when you take them out anywhere, can a parent be 100% sure that they are protecting their child from this virus? That's what I mean. But we are doing everything possible to make sure that we are following what the experts in public health tell us are the things that we need to do. But honestly, I'm surprised by the number of letters I'm getting from parents that say, open up schools. I don't want my child to physically distance. I don't want my child to have to wear a mask, who really feel that this virus isn't hitting children as hard, and that they need their kids to go back to school. And I understand that. And I understand how it's impacting their ability to work, or even how it's impacting children differently and their mental health and how well they're receiving instruction remotely. So that's why I say it's very complicated. All I can say to parents is that we will do everything possible to make schools as safe as they can be during a worldwide health pandemic.
Mm-hmm, mm-hmm. One more question on this, and then I want to take a pivot and have you hear from some of the folks who are here on the town hall. I know you're a social worker. What advice would you offer to those classroom teachers as it relates to the social, emotional health and well-being of students when they do return, in whatever format they return? Should learning and academic standards be first and foremost at the top of our list when students do come back?
So I was just, moderated a student panel yesterday that was amazing, with some high school students that were sharing their experiences. And, the one thing that all of them said that they wanted more than anything is they wanted to connect to their teachers. They wanted to connect to their counselors, their administrators. They wanted to know that the adults that were serving them cared about them. And I think that is our number one priority. Yes, there has been loss of learning, and yes, we need to get there. But as a social worker, I think you need to start where your people are at. And right now, people are struggling emotionally. People have fear and anxiety. And when you have that much fear and anxiety, I don't care how great the instruction is, you're not going to learn. So I think we need to make sure that our children are emotionally healthy, and that we are connecting with them and telling them how much we care about them, and that we are there with them and are going to help them through this. So that's my position with the social worker in me.
No, I appreciate that. So this group, as Taylor mentioned, has been really thinking across disciplines about how we help to support students in response to COVID, trying to be proactive in our approaches to think about what schools will look like, what are the needs going to be from multiple standpoints, not only from the education standpoint, but the mental health standpoint, from the medical standpoint, from a legal standpoint, because all these different systems are going to have a real profound impact on the way that students and families are going to respond when they ultimately come back to school. So I want to turn it back over to Taylor, because I think what we're going to do, just so you can have a sense of how we do this, we have folks give updates from their respective parts of the world and the work, and you can kind of see how we're building this coalition of folks across the UCLA community to see how we can best support students and their families.
Great.
Thank you so much, Dr. Duardo. Your remarks are always, to me, so inspiring, and I think so rooted in who you are in the community as a mom, and of course as the superintendent. And it's just so great to hear from you today. Thank you so much.
Thank you.
So as Dr. Howard mentioned, we do ask that folks report out from across disciplines. And just for your reference, we've had Director Bobby Cagle join our town halls. We also had Lisa Pinto from Superintendent Kuehl's office join the town hall. And so depending on the special guest, we've had different folks report. And today we have a couple of folks here to share their efforts relating to education in schools. And so I'm really excited to invite Dr. Christine Shen to introduce herself and share a little bit about what's happening with the UCLA community schools. Dr. Shen?
Good morning, Dr. Duardo and everybody else on our panel. Thank you so much for what you've shared. What I'll do today, because I have notes here, is I'm going to share an overview of our 2 community schools, some of the strengths, challenges, and then what our next steps are during this time. So just to give you an overview, the Mann UCLA Community School is part of UCLA-wide initiative to advance university-assisted community schools with LAUSD, and we have a partnership with 2 sites that serve high-need students in urban settings. The first site, the UCLA Community School, that's been in existence for a decade, and we've been working with that school. It's located in Koreatown. Today, specifically, I'm going to talk about what we are doing at Horace Mann. So UCLA started working with the Horace Mann Middle School in 2015. We formalized our partnership with LAUSD to expand and rename the school to the Mann UCLA Community School in 2016, serving grades 6 through 12. So we've added a grade level every year in 2016, and currently we have students grades 6 through 11. The demographics of our school are that 40% are Latino, 60% are African American, one of the highest in the district. We have 100% Title I students, 40% of our students are designated in special education services, and 60% are in out-of-home placement. So foster care, kinship care, group home, and homeless populations. So since 2016, we've accomplished a lot at the school site. We've increased test scores. We've had credentialed teachers in all the classrooms. This has not happened in decades at the school. We've increased enrollment. It was almost at a point where it was going to be closed, from 260 to 550, and the site can accommodate over 1,000 students. So over time, that has dwindled. This year, we have a partnership with the Children's Institute, and we opened up an on-site clinic. It was scheduled to be open right before the pandemic happened. So we've gone to a telehealth model with the Children's Institute, and we've secured college scholarships for 50% of our graduating class of 2021. So, from that, we've been experiencing a lot of progress over the last couple years. So when the pandemic happened, the inequities were exacerbated. So in talking with our kids, we know they are all experiencing high levels of food insecurity. They either have limited or no access to technology and internet connection. They have heightened trauma and grief from losing connections with their peers and teachers, and high levels of stress living with new caregivers because their families are essential workers, or they're in a homeless situation, or they are living with, I had one student that is living in a 2-bedroom apartment with 3 families. So although the school has provided technology, it is shared with everyone in the household. So there is a lot of learning loss happening beyond the social emotional trauma that the kids are facing. So at our school, we're so concerned about each and every one of our students' well-being and safety. And since March, we've struggled every day to maintain contact and identify where our kids are. And at this point, we still have, out of the 500 students, we have about 100 that have been missing since the beginning. So they have maybe come online for a few minutes or once or twice, and we don't know where those students are right now. Our students, over the last 4 years, identified Mann as a safe place with caring adults, where they can learn together with their teachers and their peers. So Jemiah, one of our 11th grade students, this is a story that she talks about a lot, where she says that before the partnership, she would come to the school to escape her problems. But since the partnership happened, she comes to school because she knows she can talk to any adult on campus and they can help solve the problems for her. So having a school that's closed and the lack of interaction with teachers it's been extremely traumatic for our kids. They consistently ask us, can they repeat their grade and just stop online learning altogether? Can we figure out a way to come back that's safe? So it's been heartbreaking working with our students and hearing that feedback. In March, immediately after school closed, our science teacher raised $1,400 from the teachers so that we could mail home things that students needed to have in order to be successful online. And so kids were asking for paper, for pencils, for headsets, for mice, food and snacks. So we did that. But as we were delivering these items, we realized that all of our kids needed that financial support. And so in the last month, working with the School of Education, the Spark campaign, we raised $20,000 to fund groceries, school supplies, and household essentials. And we have a team of teachers that are going to mail these care packages home to families. Every one of our families will have access to that fund. But as we're doing that, we still know students still need more. So, this is not unlike other schools. A lot of our schools in high needs areas are struggling with maintaining contact, providing resources that support students and families. And so we're doing the best that we can in this situation to support right now because of what is happening with the pandemic and also the things that are happening in our society right now with the Black Lives Movement. We are focused on engagement for the summer and working with community partners to develop programs focused specifically on social, emotional, and mental health. So our focus is to develop opportunities for kids to have creative outlets to process, express their feelings, have supportive facilitated dialogue, understand how they can advocate in safe ways, and mental health services for student families and their caregivers. So the middle school program academics is entirely funded by LA Unified. The high school program is where we seek funding and grants. So we'll have an art therapy course with clinicians from the Children's Institute supported by DCFS. We're gonna do a virtual camp experience where the kids can learn more about the community. And also our kids since 2016 have participated in an 8-day summer program at Lake Arrowhead. So this will be the first time they're not going to experience that. So we're gonna bring the counselors back to do something online. And we'll have some A through G high school credit-bearing courses in creative writing. The idea is to have these creative outlets for kids to express how they're feeling. And for all students that are participating in our middle and high school program, the Children's Institute has committed to supporting therapy for them both in English and Spanish. So we have had some challenges working with telehealth because of the lack with phones and Zoom, but we are going to see how we can mitigate that by writing grant funding to support the purchase of devices as well. The school district has been able to provide something for every student, but many of them aren't working properly, have access to connectivity. There's a lot of issues. So we're gonna continue working on that. And the last piece is we are worried about our families and our students' families and caregivers also. So we're trying to figure out a way to connect with them. And right now we're trying to seek some funds to develop and train a cohort of parent advocates that would partner with Mann School staff to maintain ongoing communication and contact with the assigned cohort of families so they can provide advocacy and resourcing that will begin in the summer, because we're really afraid that we're going to lose the momentum of connections with our kids in the summer. And we'll build that out for next school year, because we know that the issues that we are encountering now is going to continue for next school year. So we still have much to do. We're learning every day, but we're doing our best to attend to the immediate needs of our students and families and just really trying to figure out ways to meet the gaps. I think we are looking towards this panel, this network, to really provide resourcing and continually supporting our families and students.
Thank you so much, Dr. Shen. It's so apparent that you all are doing really everything that you can, and talk about taking lemons and making lemonade. It's incredible what you've done. And so we really thank you for sharing today. And with that, I'm going to move to Dr. Joseph Bishop, the director of the Center for the Transformation of Schools at UCLA. Dr. Bishop?
Thank you, Taylor Dudley, and to the Pritzker leadership, and to Dr. Howard and Ruby Tucker for hosting this town hall. Really appreciate you all, and good to see friends and colleagues on a Zoom call. This is how we reconnect. And I want to thank Dr. Duardo as a parent, how proactive you have been, and how much courage you've shown as a leader, because this is an incredibly difficult time to be in your shoes. So I admire you and appreciate your partnership with our center. And Dr. Shen, you've done amazing work, so it's really hard to follow up. I have 2 minutes, and John McDonald's going to time us to make sure I stay within 2 minutes. I share two resources. Good to see Karen Hunter Quartz now. I'm sharing 2 resources that are related to this conversation very briefly. Dr. Howard had a piece in Ed Week this last week, rooting out anti-Black racism in schools. If you haven't had a chance to check it out, please do. It's a great resource. Sean Harper also put something out for school leaders, what we should do. Also, I'm going to talk very, very briefly about a state report we're doing right now on student homelessness. We know that over 66,000 students are impacted by homelessness in LA County, predominantly Black and Latinx students. And we're working with Governor Newsom's team and the California Department of Ed to release a report very, very soon on the state of student homelessness. And we know that under COVID, numbers are going up, and state unemployment's at unprecedented levels, at least for the last 50 years or so. So we're going to have more work ahead for us. The Center for the Transformation of Schools, very briefly, we see schools as the first place to eradicate racism broadly and anti-Black racism very directly. We are working with school systems across the country to organize schools around the needs, talents, and interests of young people. I mentioned our report on student homelessness, which you'll hear more about later, but I want to talk very briefly about a study we're doing now. I'm looking at a subset of districts in LA County. Dr. Duardo's team has been very helpful to help us with this project. We are asking districts really questions around 2 buckets of work. One, what's the fiscal impact of COVID-19? What unexpected costs have superintendents and CBOs and chief academic officers seen related to COVID? And then on the distance learning side, what are the challenges that we're seeing? Not only what are the challenges, but what are districts doing proactively to support distance learning, to target student populations that are highly mobile, and to document it and put it in one place to help inform the state. I could share offline the 10 districts, but they are the districts with the highest enrollment in LA County, and that's a report we're also working on with our colleagues at USC, and that will be, at least an initial analysis will be ready by the end of this month. But want to again thank Pritzker for inviting us to this conversation and for your leadership during this critical time.
Thank you so much, Joe. We so appreciate your partnership and opportunity to work with you at any juncture, and especially now. I am really pleased to now introduce one of our community partners, Dr. Jordan Goins. Dr. Goins is the Director of Special Programs for the Lancaster School District, and we had the pleasure of getting introduced to Dr. Goins early on in our town hall convenings, and from really through his partnership and through the partnership of Dr. Bowers at Lancaster School District, we were able to form something that we're calling the Bruin Tutor Network, which Dr. Goins will talk a little bit more about. But since we've launched it at Lancaster School District, we've also extended it to the Children's Law Center and to their clients that they serve through the LA County foster care system, as well as several other community-based organizations. So it was really through Dr. Goins and Dr. Bowers and Dr. Howard's leadership that this program was innovated and now has been extended to other children as well. So I'll turn it to Dr. Goins to speak more about that now. Thank you.
Well, first of all, thank you, Taylor. And I wanted to extend our thanks in Lancaster to both Taylor and Dr. Howard. This has been an absolutely awesome situation for us to be able to be a part of, and be able to be on the innovative side of being able to look at a problem, be able to see what the problem is going to look, see what the problem is, and be able to try to attempt to put some barriers in the place of the problem so we can make some fixes. So basically what we're doing, the Bruin Tutor Network, we're calling it the Lancaster to UCLA Parent Tutor Project, is what we were using out here as our marketing strategy. But basically what we're doing, the biggest idea behind this was to make families the champions of their students' education. The idea being that we find, and I think in most districts, that sometimes it's hard to engage families. In our district, we have over 89.9% students who are in that free and reduced area, but however, we serve 100% free and reduced lunch. We also have a high English language learner population, as well as students who, generally speaking, the parents have everything and they want to do everything for their kid, and they put a lot of trust and a lot of love in the Lancaster School District to make that happen. So our goal was to be able to provide parents with the opportunities and the help that they would need to be able to take that over as their children came home to take part in school. So basically what we've done is we were able to utilize initially 10 awesome tutors from UCLA. That turned into 151 very quickly. Of these kids that have been involved in helping us out with the situation. And their main goal is to tutor the parents in order to help their kids. So the idea was a family engagement, was a family engagement piece, in which what we're really doing is we're trying to get the families to be able to have the ability to not just help their students on maybe one math problem, but math problems and social studies problems and language arts and other subject areas on a consistent basis through the frameworks that our tutors were being able to provide them. So basically the process goes like this, where we have an online survey, or basically like an online request form that our families are able to fill out. They fill it out, they send it comes back to us. If the families aren't able to have access to computers, we have 21 schools in our district, but we have 21 family ambassadors who will also take part in that particular piece. And so like our families are able to get in contact with them, and if they are able to once they get in contact with them, they're able to submit the questions to the family ambassadors and kind of work it through a chain. But on top of that, what ends up happening is the tutors are getting in contact with our families, and they're working through those problems with our families. The goal is to be working through the problems with the families. A lot of times they're working through those problems with the students themselves. However, what we've done is we've asked that the families, if able, are present for that particular work, so that the families can build the capacity that they need to build in order to be able to be successful in this situation. So I think that our goal right now is that we're looking to continue this into the 2021 school year. We already have plans to be able to make it happen. I've got meetings set up with some of the students next week to have discussions with them so that they have a clear understanding of what the next steps are going to end up being. We did start this, again, this happened after the COVID-19 situation. So March 13th was our last day on campus. And as soon as we hit that March 13th time period, we started developing this situation and probably got it launched around April. And once launched, we have to really understand that it was towards the end of the school year. So we've had some varied response. However, we've had enough of a response to know exactly how we're going to carry through for the following year. And we're excited about it. So I can't say enough for the partnership, and I'm hoping to be able to continue it. I'm hoping that we can continue to have these town hall meetings, and I love the fact that we're changing this over with an impact on looking into the social justice area of things, and really starting to look at what's really going on in the world outside of just the COVID-19 situation. So thank you.
Well, we thank you so much, Dr. Goins. You've been such a pleasure to work with. We're so happy to have your partnership, and like you said, to extend UCLA to the Lancaster community is very meaningful for us, especially at this time. So thank you for making that possible. Our next presenter is Dr. Alex Kelman. Dr. Kelman is the Director of Training for the DMH UCLA Prevention Center of Excellence. Dr. Kelman?
Great, thank you, Taylor. And thank you, Dr. Duardo, for joining us today. I'm really happy to be here representing our efforts at the Prevention Center of Excellence. So I am a clinical psychologist by training, and as Taylor mentioned, the director of training for our DMH UCLA Prevention Center of Excellence. This is a partnership that started in August of 2018, and it was launched as a public-public partnership between DMH and UCLA to really support the development of countywide trauma and resilience-informed schools, as well as other systems of care through training, coaching, consultation, and technical support. I'm happy to report that since our launch back in August of 2018, we've been able to work directly in training with about 4,000 educators, administrators, and school staff across 123 trainings. And we've also been actively involved alongside our DMH and LACO partners in the LACO Community Schools work, providing training and consultation support both for the LACO staff who have been added to be a part of these community schools, as well as for the schools themselves, both individually as well as all school PDs, to try to enhance the cohesion and cross-pollination across the various community schools. In terms of the work that we're really doing to meet the moment, I wanted to just focus on briefly two aspects, one being our training and another being our online learning center, which was recently launched as of January of this year. So in terms of our training, we've really, in response to COVID, we've made a lot of large shifts in the context of our work with schools and educators specifically. We've pivoted to online delivery, which means, of course, in our trainings are largely experiential in nature, and so we've really tried to step up and enhance our own professional development to then be able to do the things that we feel like we really do quite well to then be able to do in an online space. And so what we've really been working on is not just with our core trainings like our trauma and resilience informed foundations, but also addition of new trainings, really make sure we're rooting content in the moment and really kind of addressing the specific needs of COVID specifically, and then now kind of the highlights and the additions of the structural kind of systemic inequality that has been going on in our country since its inception, that we're now seeing kind of inflammations, during COVID with the disproportionate impacts. And so, you see this in our curricula that we're developing, such as keeping students safe during COVID-19, educating or enhancing educator well-being, as well as really kind of bolstering our implicit bias work in schools, and not only training, but also for us, so much of a training program is rooted not in the training itself, but in the ongoing capacity building that comes with, working with educators and partnering with champions to make sure that we're helping to kind of build the roots through which then these efforts can grow within individual schools and systems. And so in terms of like the addition, not only of COVID, but again, wanting to make sure, because we've addressed in our trainings systemic racism, structural inequality, social determinants of health since the start. And at the same time, we're really, wanting to invest even deeper and braver in this work. And Dr. Duardo, to your point about really the starting at home, is we're really trying to address the work we're doing in the same way. I mean, for us, it's about like really co-constructing spaces for internal dialogue, both, in meetings as well as, internal trainings, small group discussions, but finding ways to really shine light on what we can do kind of within our own structure that has its own history, that, by nature of being in a university and, just structurally kind of all of the different kind of white supremacist things that have just inherently kind of become just part of the bones of any structure we exist within by nature of just the history and the ways in which these things have been built, but to really for us to be cognizant of what we can do within our center to really reflect bravely, to have these conversations with one another so that we can then be of real service to the partners that we work alongside of. And so for us, really starting that at home alongside really making sure to augment our curricula offerings, adding in current context on again, the COVID pieces, as well as the disproportionate impacts on communities of color, especially Black people right now. And also really just a systematized way of making sure that like even our trainings that have been constructed previously don't inadvertently have bias in it that we perhaps did not see earlier, and as such would then need to do something and would want to do something about. And so on the training front, that's kind of our broad strokes. And then from our Learning Center perspective, which again is our online structure, it houses all of our resources from automated courses that people can take on their own schedules, to video series, to resources, to other tools for workforce development, practice, and professional well-being. We've really not only bolstered our courses here, but really also added additional resources that speak to what we're dealing with at the moment. And one of perhaps the most salient of these additional resources for our work with educators is our new Educators Overcoming Under Stress series that talks about navigating COVID, disproportionate impacts on communities of color, and reintegration, reentry into school as well. And so I know many of those on the call, actually Dr. Duardo, Dr. Howard, and Dr. Baer have all generously offered their time to be interviewees on this. And Dr. Howard, I believe, even an interviewer for Dr. Duardo. So grateful to those of y'all on the call for, lending your expertise and your time to then help us kind of shine light on things. We also have some upcoming additional interviews with Dr. John Shearer and with Ms. Jewel Forbes from LACO in the coming weeks. And so really kind of coming up at the end of my time in summation, we're really maintaining course in terms of our core values of helping to develop trauma and resilience informed resources to then be of service to schools and other sectors of the county. And then also making sure we're really kind of being responsive to the needs of now, augmenting our trainings and our offerings and our learning center, and doing so in a way where we're really kind of working, collectively to kind of do so in brave spaces and have the hard conversations and be uncomfortable in the ways that we need to be uncomfortable to really shine light on what needs to be shown light upon. And so we really look forward to continue to work alongside LACO in service of a more compassionate and just education system, and are so appreciative to be included here today.
Thank you so much, Dr. Kell.
Yeah.
Echoing. My echoing, Laura? Am I still echoing? So we were going to take a question. I'll turn it to Dr. Howard to finish it off. But again, thank you so much to participants.
I'll take it over. I don't know if I'm in, but I'm echoing too. We have about 5 minutes, and we wanted to open it up to see if anyone has specific questions for Dr. Duardo before we have to close out our session. And maybe you won't go.
I have a question for Dr. Duardo. Actually, I just wanted to actually say thank you for the framework that you guys put together. My superintendent was involved in that conversation with you, and that's been something that's guided us in terms of the work that we're doing currently to try to put together a cohesive system as we're moving back into the situation, moving into 2021. It was very helpful in terms of having some specific best practices to make sure that we were accomplishing and going after. So I just wanted to thank you for that.
Thank you. I'm glad it was helpful. And Dr. Bauer is amazing. She serves as one of the superintendents on my advisory council, and has taken the lead in assisting us with that. So thank you.
All right.
Well, if nobody has any questions for me, I just wanted to say thank you to everybody who shared information. We have, as many of you know, our Community Schools Initiative, because we really believe that schools should be the hub of community services, and that schools really are trusted places where parents and families feel more comfortable coming for resources. So I was glad to learn more about the community schools effort in Koreatown and Horace Mann. And as far as one of the things you talked about is, looking for additional funding. LACO, we started our own philanthropic branch. It's called the Greater LA Foundation, and it's basically there just to raise money for districts as well as LACO programs to support the partnerships, to support more research around systemic racism and inequities that have existed long before this pandemic, that have become much more clear as a result of the pandemic. We've worked very closely with Dr. Bishop and Dr. Pedro Noguera, as well as Dr. Howard, who we've been able to partner on many things. And as far as Dr. Kelman with UCLA, we've been doing a lot of work in partnership with DMH. Really appreciate the support in the curricula that's being developed that will help our districts. You know, what we're trying to do is not have 80 districts have to go out at this on their own. And the more that we can have in place, and the more partnerships and the more resources that we can share, the better off all of our, 1.5 million, 2 million kids, if you want to count our preschool students, will have access to. So I've always believed in the power of partnerships and leveraging resources. And whenever we can bring, our universities and higher academia together with the practitioners, we're going to see much greater progress. And I just wanted to say thank you to all of you for the support that you've provided, and appreciate learning from all of you.
Thank you so much, Dr. Duardo. That's certainly our goal, and it's something that we will continue to do more of. And we invite your feedback and your suggestions, your need for support anytime. And we really appreciate you being with us today. And I'll turn it back over to Dr. Howard. We seem to have stopped echoing, and I think he'll send us off. Thank you so much again, Dr. Duardo. It's such a pleasure always to be in your company. Thank you.
Yes. Thank you, Dr. Duardo. Part of what we wanted to do was to have you to come to share with us what is happening from your vantage point with LACO, but at the same time to hear about what this group has been doing. One thing I really respect and admire about this group, we are action focused and results oriented. You've heard it all, from tutoring to training, to outreach, to research, to online platforming. What you didn't hear about is Taylor's connection with Baby to Baby, where we had shoes and diapers and formula delivered to some of our schools. It's been very much about supporting our children and families in as many ways as possible. So I can't say thank you enough to all the folks who are here. Dr. Christine Shin, Dr. Anna Marie Francois, she and I are on a committee with school board member Jackie Goldberg on how to open up LAUSD. Dr. Goins, his work out in Lancaster has been just amazing. Dr. Joe Bishop, his work has been critical. And though she's quiet here, she's always been a huge support. Winnie Wechsler, I can't say thank you enough for her support, her advocacy. She is always asking me, what about man? What about man? What about man? How do we support man? So that is, it's so refreshing to have folks who are committed to this. So please use us, Dr. Duardo, as a resource. If there are ideas, if there are suggestions, if there are recommendations that you think could help us, or also, and I don't know how often you hear this, if we can help you from where you sit, because we know you get inundated with lots of requests, but probably not as many offers of help. So this is one place and one entity that wants to be of service to you. So with that being said, I cannot say thank you enough. In the interest of respecting everyone's time, we want to say thank you, thank you, Taylor, for another wonderful host. Ruby, the team at the Pritzker Center, it's so amazing in putting this together. And I just want you all to be safe, have a great weekend, and continue to keep the fight.